The essence of anatomy is that through anatomy we learn the human being and we learn the depth of the human being. Now rest of the subject that we will be studying in biochemistry, in the physiology or anything else, you won't be studying that particular subjects in depth, or I would say in real. What I am saying, the part which you will be learning on those sessions are virtual. That means you cannot see them, you cannot just like understand what the process is going on there actually and seeing them, because they are microscopic or super microscopic structure that we cannot see. Rather in here we can demonstrate the content on whatever the things I am saying. I will have a luxury of showing you that this is what I am saying and this is what is expected of. Now our human body is made of like muscles, soft tissue structures which we call them as muscles, nerves, blood vessels, and as well as the coverings of this particular element which is wrapped together in a packing material which we call them as adipose tissue or fats, which is present all through it. And as well as we have the solid endoskeleton, we call them as the bones, right? And bones is also some parts, we have a softer element of the bones, we call them as cartilages. So these are the like elements which you are going to see. Now in anatomy we are going to call this particular organs inside as viscera, like organs, alright. So viscera means organs, so you should be able to familiarize with this particular terms whatever we are saying. Like viscera, we are saying the organs, like the liver, kidney, the heart, etc., which is we use that for different purposes. The bones we call them as osteology, with the osteons, cartilages, bones, etc., will be there. We will be learning those elements. And as well as the muscles are muscles, we call them as muscles, as different areas of the muscle. Based on the muscle as they are performing the actions, we can classify them. Some of them are bending the joints, we call them as flexion. Some of them as unfolding the joint, that means extending, we call them as extension. Some of them are moving this particular joint away, we call them as lateral movers, moving away laterally, away from the midline. And some of them is bringing close to the midline, that we call them as medial movers. And as well as collections of all these things, we call them as rotation. That means it can just like make a move around. Rotations may be like 360 degree, it may be like a 280 degree, or you have a range of the movement which may be there. In some of the joints it has a wide range of movement, it moves a lot. Some of them has a restricted movement, it's only 90 degree, etc., etc. We will be learning on that. Now in this particular elemental class, we will be focusing on the things which is called a microanatomy, or we call them as histoanatomy. This is a foundation what we are going to learn over the things which is going to see whatever we cannot see, the cells and organelles, etc., which you are going to see in through microscope. That means it's not visible through naked eyes and we have to identify them, this particular thing is existing on it. Largely or grossly we are learning the normal anatomy of human microanatomy of the organ cells, etc. This is the foundation. Now what is the clinical application? The disease part of this will be taught in next same, we call them as pathology. So pathological anatomy and pathological orientations of the things which is going to be founded in here will be tested on that. And based on that, as you come across with this Med 4 and after finally completing the internships, etc., so you will be having a wholesome idea of the human bodies, like a more about the gross anatomy as well as microanatomy. So combined together is there. Now we do have an invisible part as well in anatomy. We call them as the embryological aspects. So embryology we cannot see, that is whatever the things is happening before we were born, that happened in case of the mother's womb or in utero. In utero means that is inside the uterus, it was growing, it happened there. We cannot show you what exactly that is happening. It is little bit like imaginary, it has to be, you have to think it. That part of the anatomy in that extent is a little bit virtual. So we have to use the technology, we have to use thinking power, we have to use three-dimensional pictures, some of the videos, clippings, etc., to understand those things about what happened in utero or before we are born. So that historical thing that happened, those elements we cannot demonstrate in our classes or all these elements. Rest of the anatomy is pretty much is visible. Now coming to the exams, what is expected of anatomy exam of histology sections in during examination. Now what anatomy usually teaches us in this particular histology session is that we take a tissue, small sections of the tissue, and we prepare the smaller sections of the tissue with staining with some kind of dyes, and once you stain this particular with the dyes, and then we just like fix it or glue it in this kind of slides like this, and after that we place under the microscope and see and observe what that particular organ is composed of, like what are the cells, what are the tissues, what are the glands, and what are the other elements that is present in it. Now, our part for the examination part is that we have to identify these particular organs, and we have to know the characteristics of the organs that is present on it. Say for example, if you are identifying the liver, so we should be knowing this is the liver, and we should be knowing what are the features of the liver is. That means liver looks like this, or micro section of the liver, once stained, we are seeing under microscopes, looks like this. So we have to memorize this particular liver which has a particular features, and that particular micro feature we have to memorize, and based on this memorizing we should be able to identify any liver specimen given to us during examination or whatever is given to it. So that identifying feature or that identifying point we have to prepare, we have to know, we have to memorize, and we have to rehearse ourselves. Now this is not a big deal about identifying this particular thing, just like looking a picture and identifying the, alright, this picture looks like this, and once you know this picture has this one here, this one there, and this one is. So it's a kind of picture memorizing and putting a logic to it, why this is present in here and what is the purpose of this thing. So if you do not know that what is the purpose of the thing, we cannot just memorize the blank fact, because it will be evaporating out, you will be forgetting soon. So once you see any structure in a microscopic structures, then we have to identify this is what I am seeing here is present only in liver, and that is a hallmark structure. That means this is only present in liver, no other structure has this, that's why we are identifying it. Now this is the logic, and what's the function of that particular organ. In case of the liver, we call them as the cells which is in the liver, we call them as hepatocytes. We call them as hepatocytes. Now hepatocytes are arranged like cords, that means they are arranged in line, and this particular line is arranged in a way they are radiating in from a source. That means they are just like rays. So from a source, say for example it's the sun, if it is there, it's a sun rays are coming out, it's a radiating thing. So this particular element is also the cords of this particular liver cells, we call them as hepatocytes, is having a radiating fashion of orientation, and it is coming from a point, that sun, we call them as the central cavity. So we find a hollow central cavity, and from there we have a radiating course, and it is limited by some extent, where we seeing that end of this particular liver cells radiating, or liver cells rays are radiating, ending to a point we call them as porta hepatis. That particular point it ends and begins with something else. So these particular elements we should be identifying whenever this particular element is given on microscopes. We will be seeing what these particular cells are there, it looks like this or not, it's a radiating manner or not, or if we can identify porta hepatis kind of element which is present in it, etc. Right? So this is where we are going to identify. So that's a point. Now once you have identified, during examination we just like give you like roughly like a 40 specimen to identify, and you should be identifying 40 different specimens, identifying about features, 1 or 2 or 3 features. So we will be identifying them, we will be drawing them, we will be memorizing them, and we will be seeing what are the things which is going in this particular element and identifying during the examination. During examination we usually give 5 to 10 slides depending on the exams. If you have small exam, we give 5 slides. If it is a big exam like university exam, we give you 10 slides. We ask you to identify the slides. And once you identify, it is implied you should be able to write 2 or 3 identifying features or points. Like this is one, like one liner identifying points. We do not want an essay for it. We just want you to say that this is liver because this has this, because this has this, point 1, point 2, that's it. And we should be able to make a drawing picture of it. Now, how much portions of questions in numbers we will be getting? So in a practical exam, we have 100 marks practical exam. This particular histology exam is 10 marks will be given according to it. So 10 slides you will be identifying with this identifying features. So if you identify the points rightly, correctly, you will get 100 out of 100. So if you correctly identify this particular point, and write it the characteristic feature of that particular slide, you will get 100% of it. That means you get full award. Now, in terms of like identifying points regard to this histology in terms of theoretical part. Now, we have two papers in anatomy, paper 1, paper 2. We see that in paper 1, we get a short essay type questions on the histology slide or descriptions of histology, and so is in paper 2 as well. We get a short questions of 4 marks question usually on the histological features of it. That means whatever the theoretical thing which you are writing, you should be able to write it in a small short note fashion. So, we have to prepare this particular class in 2 ways, identifying for the practical exam and prepare as well for the short note for the professional exams. In the short note professional exams, what we have, usually they ask you that write with a diagram about histological feature of liver or any organ, liver or spleen or heart or lungs, etc., etc. That means you have to write it about this particular organs, introductions, features, a small diagram. You do not have to be Leonardo da Vinci or any Van Gogh for drawing this particular picture. Any presentable picture is good with giving this particular proper thing labeled, right. So, this is this and this is that, and then the clinical points related to it, that we will be learning slowly. What are the clinical points? That is 1 or 2 which is related to it. So, there is the aim of this particular class, which will be quickly wrapping up this particular theoretical content and quickly wrapping about the practical content. Okay. So, this is about in short, in gist, about what is expected of this particular class. So, we will be meeting twice in a week for this particular histology session. We try to wrap up the things quick in case of the histology identifying of the slides and learning about the theoretical part of it. So, whenever you are getting this particular thing, you prepare this particular class, spend half an hour by compressing the content on it, just like 5 or 6 sentences of that particular slide, whichever you are learning. So, in a short 5 or 6 liner content or brief content, you will be having that particular organ with the schematic diagram that will end the story. And later on, just that particular 5 liner thing, the gist of the thing, and with the diagram, you will be revising it. So, if you have 40 slides, you should have a 40-page small book pages of that particular thing written, and that particular thing you will be carrying through it. That is the class notes for it, and you will be carrying through it. You do not have to revise, memorize every day, but only just like have to go through these pages of it, so that you just like have a feel of whatever you have learned so far. So, your brain should be knowing we have studied this, and this is the feature. Okay, I will just like go on memorizing. So, every day you just like spend 3 or 4 minutes on that particular thing, whatever you like, whatever you have studied, that is enough. So, anatomy studying has a technique. This technique is that repeated hammering, but it is a short brisk hammering. If you just like read it like history, like 3 hours anatomy study, it is not going to study, because by the time you finish the page, you will forget the whatever you studied 3 years before. So, 3 hours long anatomy study is not going to work. It has to be 15 minutes, 20 minutes study, and again moving to new topics, because after 15 minutes, you will be just like forgetting the thing whatever you have learned. So, it is a very highly volatile content, and by the time you have just like studied one content, spending 3 hours, and once you move out of the table, you remember nothing, that you will depress yourself with your moral that I spent 3 hours, I cannot memorize any bit of it, and that is a normal thing. So, rather than doing that thing, spending 3 hours, you study 30 topics and say, all right, 30 topics I can remember at least one. So, which is more wiser or good investment in terms of spending time on it, right? So, 20 or 30 minutes you spend time on a content. If you can memorize something on it, it's good, or else let go, move to another content and then study it. And after a few days again you come back, whichever the content you cannot memorize the thing, spending 30 minutes and redo that. So, you cannot stick to a book more than 30 minutes to a particular topic in anatomy. Every anatomist should have a drawing to yourself. Maybe it look like a scarecrow drawing, but even that will suffice for us as long as you are getting some kind of memory impacted to the drawing. I made a scarecrow drawing, that is remembering with something like this. So, that particular memory link is important for anatomy. No matter how you read, it's going to be volatile, you are going to forget. And it is, everybody had this particular element, right? No matter how you sleep, you will be feeling sleepy in class. That's a normal thing. Our prime thing about anatomy is that in a histology class is going to be learned through the microscopes. So we should be learning this particular handling of the microscopes, and how much is handling a microscope is allowed to you, you should be knowing. Now for the class you can do anything except breaking them. Now once you have seen this particular microscope, if you have seen them in your like a 10 or 10+2 schools or the academic institutions where you are from, it's good, or else you can get familiarized with the microscope. Most of the microscopes out here are binocular microscope. That means you have to use both eyes to look into it. Usually in the schools or in a kind of like institutions where 10 or 10+2 binocular microscopes are not given. Some of them are given unicular, so you have to just like close one eyes, look through them. Here you have to keep the both eyes open and see the content. Now the thing is that whenever you are looking in it, looking through both eyes open, looking through this binocular microscope, sometimes you may not be able to orient yourself with your vision with this particular projections that is coming through it. So the aim is that you have to relax your eyes and look through horizons. That means you are looking to something distant. So as your aim is that not you are looking through the glasses like this, you as if you are looking through a far distance. So that will relax your eye muscles so that you can easily see this particular thing. This will be looking like two overlap visions. Gradually you will be seeing that single. It has an eyepiece which can be moved like depending on your eye or positions of the iris. So you can just like gently, you can just like or you can just like bend it little bit if it is still working there. This particular hinge over there may be like very stiff out there. So usually the binocular microscope, the eyepiece distance which is looking through this particular element which is on the projected up, the eyepiece is flexible. It is little bit adjustable, just like adjustable car seats. And then you have this particular lens which is inside, and it has 3 different kind of lens that can be moved around. So the lens which you will be practicing in here is 10x zoom. So that zoom which you will be using is 10x zoom. That means 10 times you will be magnifying it. So there are 40x zooms, there are 100x zooms. That means you can enlarge them 100 times, you can enlarge them 40 times. But for us, is allowed parameter is 10x zoom. So that's the thing we will be practicing. We will be seeing how it looks like in 40x zooming or 100x zooming, but that's not for us to train our eyes. So our eyes should be trained to look the object in 10x zoom. So in 10x zoom, we will be seeing this particular object, how this particular element looks like. Now these are kind of slides which is the organs it has. So it is pasted, as I am saying, it is glued in here. We should be placing this particular element on this particular horizontal plate, we call them a stage. So on the stage it has a clip and it is a slider which can move up and down, right and left. So depending on, we can move this. Now there is a light source, this kind of microscopes, the binocular microscope, which has a optical zoom. That means it has a light source inbuilt. Otherwise some of the microscopes we have to use this particular light source which is from the environment, and we have a mirror to reflect it. Through the mirror reflections we see this particular light projected running through this and getting to our eyes. That's what we are seeing here. In this we have a filament which has a bulb which can be just like adjusted. The filament strength can be adjusted, it can be brightened, it can be dumped, and then we can just like adjust how much of light is coming on it and see this particular element by moving. So you see that this particular tissue, as you see in the central position, so that it is roughly present in here. So we have to just like move the slider so that this particular light source is penetrating through this particular tissues, it is coming in here. So we cannot put this particular microscope's slider in a point where this particular element is throwing the lights, because it has no tissue, we cannot see them. So with the purpose of the stage slider is there so that we can adjust it right and left, right. So we should be able to identify this particular slider mover right and left, front and back, these elements. And as well as we can just like adjust this particular mirror eyepiece element as we can just like project it down and move it little bit up. So this particular element, this particular microscopes are binocular microscopes which has a light source, binocular microscopes which will be using the illuminations, or this particular length or strength of the bulb can be adjusted. It is a slide mover. It has a two lens is present inside. One lens is fitted inside, which you cannot see. You have to break this particular instrument to see that particular lens. Second lens is, we can see that, which is we can move over here. We call them as nose piece. So you see that there are 3 or 4 lenses are fitted on this particular microscope, which is 10x zoom, 40x zoom and 100x zoom, and it has a kind of microscope which we call them an oil immersion zoom. So this particular lenses can be externally visible. So external visible microscopes are there. They are hanging from a point. We call them as nose piece. So that particular nose piece is there, which is can be moved or can be rotated, and we can just like move through different magnifications of this particular microscope and see this particular content. Now, to adjust this particular lights and to adjust this particular focus, we have 2 knobs to adjust. We have a major or coarse knob, which is a bigger knob, and then we have a finer knob to fine adjust. That means you have to focus it so that this particular things becomes visible, but it becomes blurry. Now, once it is focused, then we make a finer adjustment. That means we clarify this particular picture, make it more clear. So we have 2 knobs. We could quickly identify the 2 knobs in this particular microscope. They are usually on the right side of this particular microscope, circular. There may be a conjoined knob, that means a big knob, and fitted with inside is a small knob, or maybe we have a big knob separate and a small knob separate. Now, how much is allowed for us to touch the microscope during examination? During the examinations, we are only allowed to touch the small knob or fine adjustment knob button only. We cannot touch anything else during examination. We cannot move the slider, we cannot adjust this particular length, we cannot move this particular slider front and back, neither we can do the finer coarse adjustments. We cannot move this piece to just like get this different kind of lens. No, you are not allowed. So only you can just like through the eyepiece, which is present on this particular black one eyepiece through it, and then we can only clarify or claritize this particular slide which you are seeing here. We can sharpen the picture only. The small knob on the right we can touch only. Anything else it's not for us during examination. Now, during when you are seeing the practical things, you can do anything you want unless you are breaking them, that's a deal, right? So this handling the microscope is important. So right now I want you to go through the microscope, whatever you can get, see the microscope. There are plenty of them, and you guys can find for yourself any microscope. So see the microscopes, whatever things you have, any empty or vacant microscopes is there, and see the microscopes and different parts of it. কোনটা ফাইন হবে, কোনটা কোর্স হবে, কোনটা স্লাইড মুভ হবে, দেখতে দাও। এটা কি বলে? স্টেজ। কি বলে? স্টেজ। এটা কি বলে? স্লাইড ক্লিপ। এটাকে কি বলে? স্লাইড মুভার। এই যে সামনে পিছনে আগে পিছে, ঠিক আছে? এটাকে স্টেজ মুভার। এই দেখ স্টেজটাকে উপর নিচে করছি, তাই তো? এটা ফোকাস করার জন্য। বাল্বটা হচ্ছে এইখানে আছে, এটা সুইচ অন অফ। এটাকে দেখ বাল্বটার আমি লুমিনেন্সটা বাড়াতে কমাতে পারি। কমলো? বাড়লো? আচ্ছা, আলোটা কমিয়ে দিলাম আমি। হ্যাঁ, এই ছোট নবটা যেটা ঘোরাচ্ছি সেটার নাম কি? এটাকে বলে ফাইন অ্যাডজাস্টমেন্ট। আর এটা স্টেজ মুভ করে আপনার এটা কোর্স অ্যাডজাস্টমেন্ট। পরীক্ষার সময় খালি এই ছোটটাকে আমার টাচ করতে দেবে, ঠিক আছে? এইটা খালি আমি মুভ করতে পারবো, টাচ করতে পারবো পরীক্ষার সময়। আর এখন সবকিছুই পারবো, ঠিক আছে? আইপিস, নোজ পিস, স্টেজ, ফুট, এটা স্লাইড আপ ডাউন করে যেটা কোর্স অ্যাডজাস্টমেন্ট, ফাইন অ্যাডজাস্টমেন্ট, এটা ডায়াফ্রাম বলে। এই যে এইটা তালায় আছে ডায়াফ্রাম, হ্যাঁ, এটাকে উপর নিচে করা যায়, ঠিক আছে? আমি ডেপথটা বাড়ানো কমানো সব করতে পারি এটাকে, ঠিক আছে? আর এটা হচ্ছে লাইট সোর্স, এটা মিরর বেসিক্যালি, হ্যাঁ, মিরর। কেমন? বেশ। নোজ পিস, নোজ পিস এগুলো কি আছে? এগুলো সিলিন্ডারের মতো, এগুলোকে বলে লেন্স। কত ম্যাগনিফিকেশন লেখা আছে, এটা এত ম্যাগনিফিকেশন, এটা এত লেখা আছে, ঠিক আছে? দেখে দেখে বুঝতে পারবো আমরা কত ম্যাগনিফিকেশন রয়েছে। আমরা কিসে দেখবো? 10x এ। 10x এ একটা কালারও ইউজ করা হয়, ঠিক আছে? এইবারে একটা বড় নাও আছে, এটাকে বলে কোর্স অ্যাডজাস্টমেন্ট, এটাকে স্টেজটাকে উপর নিচে